Welcome to a comprehensive journey through the anatomy and physiology of the human eye. The eye is one of the most complex and vital sense organs, allowing us to perceive the world in vivid detail. In this video, we'll explore how the eye develops, its intricate structure, and the fascinating processes that enable vision. From the embryological origins to the specialized tissues and functions, each part of the eye plays a crucial role in sight. Let's begin by understanding how the eye forms during early development, setting the stage for its remarkable capabilities. Development of the central nervous system, including the eye, begins with the neural tube. The outer layer is formed by the surface ectoderm, while the inner layer is the neural ectoderm. Between these layers lies the mesoderm. As the forebrain develops, neural ectoderm projects outward to form optic vesicles, which are the early precursors of the eyes. This process involves a delicate interplay between the surface ectoderm, neural ectoderm, and mesoderm, each contributing to different eye structures. Understanding these origins is key to appreciating the eye's complexity. As the optic vesicle invaginates, it forms the optic cup, a crucial step in eye development. Simultaneously, the surface ectoderm also invaginates, creating the lens vesicle. These coordinated invaginations set the foundation for the retina and lens. The optic cup's outer layer becomes the pigment epithelium of the retina, while its inner layer develops into the retina's 9 functional layers. The nerve fiber layer grows backward, forming the optic nerve, which connects the eye to the brain. The lens, meanwhile, is derived from the posterior cells of the lens vesicle. Surrounding the optic cup, the mesoderm differentiates to form the coats of the eyeball, the choroid and sclera. These layers provide structural support and protection. The choroid is rich in blood vessels, supplying nutrients to the eye, while the sclera forms the tough, white outer layer. As the eye continues to develop, extensions from the optic cup give rise to the ciliary body and iris, which are essential for focusing and regulating light entry. The hyaloid artery supplies nourishment during development, later replaced by the vitreous humor. Cornea and conjunctival epithelium originate from the surface ectoderm, while the underlying stroma and endothelium are mesodermal in origin. The eyelids develop from folds of surface ectoderm that grow in front of the cornea, unite, and later separate. Mesoderm is present between the two layers of the eyelids, contributing to their structure. The extraocular muscles, ciliary muscles, orbital contents, and bony orbit also arise from the mesoderm, highlighting the collaborative development of various tissues in the eye. Summarize: the eye structures develop from 3 primary sources: surface ectoderm, mesoderm, and neural ectoderm. The conjunctival and corneal epithelium, crystalline lens, and eyelids derive from the surface ectoderm. The corneal stroma, iris stroma, ciliary body, and extraocular muscles originate from the mesoderm. The retina, optic nerve, and pigment epithelium are products of the neural ectoderm. This intricate interplay ensures the formation of a fully functional eye, ready for the complex task of vision. Human eye is a marvel of biological engineering, roughly spherical and about 2.5 centimeters in diameter. It sits within the bony orbit, cushioned and protected by fatty tissue. The eye can be divided into ocular within the eyeball and extraocular surrounding structures components. Its 3 main coats, the fibrous, vascular, and nervous layers, each serve distinct functions from protection to nutrient supply and light reception. Let's delve into each of these layers to see how they contribute to vision. The outermost layer of the eyeball is the fibrous coat, consisting of the sclera and cornea. The sclera is a tough, opaque white tissue that maintains the shape of the eye and provides protection. It forms about 5/6 of the outer coat. The cornea, making up the remaining 1/6, is transparent and allows light to enter the eye. Its smooth, curved surface is essential for focusing light. Both structures are continuous, with the cornea resembling the glass of a watch, perfectly clear and avascular for optimal vision. Cornea is composed of 5 distinct layers: the epithelial cell layer, Bowman's membrane, substantia propria, stroma, Descemet's membrane, and the endothelial cell layer. Each layer has a specialized function. The epithelium protects and regenerates quickly, while Bowman's membrane provides strength but does not regenerate if damaged. The stroma is the thickest layer, maintaining transparency through its regular arrangement. Descemet's membrane is elastic and strong, and the endothelium regulates hydration, crucial for corneal clarity. Despite being avascular, the cornea receives nutrients through diffusion from the paralimbal capillaries and aqueous humor. Oxygen is absorbed directly from the air. The cornea is richly innervated by the ophthalmic division of the trigeminal nerve, providing touch, pain, and thermal sensations. This unique arrangement ensures the cornea remains transparent and sensitive, essential for clear vision and protection against injury. Limbus is a narrow, semi-transparent zone about 1 wide, marking the transition between the cornea and the sclera. It contains important anatomical landmarks, including the termination of Bowman's and Descemet's membranes. The limbus is significant in surgery, as incisions here are safest for intraocular procedures. Its unique structure supports the health and regeneration of both the cornea and conjunctiva. Middle layer of the eye, known as the uveal tract, consists of the iris, ciliary body, and choroid. The iris and ciliary body form the anterior uvea, while the choroid is the posterior uvea. These structures are interconnected and highly vascular, playing key roles in regulating light entry, focusing, and nourishing the eye. The uveal tract's close relationship with the corneal endothelium means that diseases can easily spread between these layers. The iris is a colored, circular diaphragm suspended between the cornea and lens. It controls the size of the pupil, regulating the amount of light entering the eye. The iris consists of connective tissue, stroma, pigment cells, and 2 types of muscle fibers: the sphincter pupillae, which constricts the pupil, and the dilator pupillae, which widens it. These muscles are controlled by the autonomic nervous system, allowing the eye to adapt to varying light conditions. Ciliary body encircles the periphery of the iris and contains ciliary muscles, pigment cells, and blood vessels. Its interior portion, the ciliary processes, produces aqueous humor, nourishing avascular structures like the cornea and lens. The ciliary muscles, arranged in meridional, radiating, and circular fibers, play a vital role in accommodation, adjusting the lens shape for near and distant vision. The ciliary body's rich sensory innervation makes pain from inflammation particularly intense. Choroid is a vascular layer sandwiched between the sclera and retina. It is packed with blood vessels arranged in 3 layers, providing oxygen and nutrients to the outer retina. The innermost layer, the chorioca pilaris, is especially important for nourishing the retinal pigment epithelium and photoreceptors. The choroid's pigmented cells also help absorb excess light, preventing internal reflection and enhancing visual clarity. Retina is a thin, delicate membrane lining the inner surface of the eye. It contains photoreceptor cells, rods, and cones that convert light into electrical signals. The retina is organized into multiple layers, including the pigment epithelium, nuclear layers, and plexiform layers, each with specialized functions. The macula, located near the center, is responsible for sharp, detailed vision, while the peripheral retina is crucial for night and peripheral vision. Optic nerve is formed by the axons of retinal ganglion cells and transmits visual information from the eye to the brain. At the optic disc, all retinal layers except the nerve fiber layer stop abruptly, creating a blind spot. The optic nerves from both eyes converge at the optic chiasma, where fibers cross and continue as optic tracts to the lateral geniculate bodies and finally to the visual cortex in the occipital lobe. This pathway is essential for processing and interpreting visual stimuli. Eye contains 2 main chambers: the interior chamber located between the cornea and iris, and the posterior chamber between the iris and lens. Both are filled with aqueous humor, clear fluid that maintains intraocular pressure and provides nutrients to avascular structures. The interior chamber is about 2.5 deep in adults, and its angle contains important drainage structures like the trabecular meshwork and canal of Schlemm, which regulate fluid outflow. Aqueous humor is produced mainly by the ciliary processes and flows from the posterior chamber through the pupil into the interior chamber. It drains via the trabecular meshwork and canal of Schlemm into the venous system. This constant circulation maintains intraocular pressure and supplies nutrients to the cornea and lens. Any imbalance in production or drainage can lead to increased pressure, a key factor in glaucoma. Lens is a transparent, biconvex structure situated behind the iris. It is held in place by suspensory ligaments attached to the ciliary body. The lens focuses light onto the retina and adjusts its shape for near and distant vision, a process called accommodation. The lens grows throughout life, with new fibers forming at the periphery and older fibers compacted toward the center, resulting in increased density with age. Vitreous humor is a clear gelatinous substance filling the space between the lens and retina. It provides structural support, maintains the shape of the eye, and allows light to pass unobstructed to the retina. The vitreous is avascular and receives nutrients from surrounding tissues. With age or disease, the vitreous can degenerate, leading to floaters or opacities that may affect vision. Conjunctiva is a thin, transparent mucous membrane covering the posterior surface of the eyelids and the interior part of the sclera. It keeps the eye moist, protects against infection, and allows smooth movement of the eyeball. The conjunctiva contains goblet cells that secrete mucus and accessory lacrimal glands that contribute to tear production. Its rich blood supply and lymphatic drainage help defend against pathogens. Eyelids are movable folds of skin and muscle that protect the eyes from injury, excessive light, and dehydration. They contain several layers including skin, connective tissue, muscles, tarsal plates, and conjunctiva. Specialized glands within the eyelids, such as meibomian, Zeiss, and Mall glands, secrete oils and mucus that maintain tear film stability and prevent evaporation. Eyelashes along the lid margins trap dust and debris. Lacrimal apparatus consists of the lacrimal gland, ducts, puncta, canaliculi, lacrimal sac, and nasolacrimal duct. The lacrimal gland, located in the upper outer orbit, produces tears that lubricate and protect the eye. Tears drain through the puncta into the canaliculi, then into the lacrimal sac and nasolacrimal duct, finally reaching the nasal cavity. This system ensures the eye remains moist, clear of debris, and protected from infection. Ears serve multiple functions. They lubricate the eye, maintain corneal transparency, wash away foreign particles, and contain antimicrobial substances like lysozyme and immunoglobulins. The blinking action of the eyelid spreads tears evenly across the eye surface, ensuring optimal hydration and protection. Emotional and reflex tearing can increase tear production, helping to flush out irritants or respond to psychological stimuli. Orbit is a bony cavity formed by 7 bones, providing protection and support for the eyeball and its associated structures. The orbit's walls vary in thickness, with the lateral wall being the strongest and the medial wall the thinnest. The orbital cavity contains fat, muscles, nerves, and blood vessels, all essential for eye movement and function. The proximity of the orbit to the sinuses means that infections can sometimes spread to or from the eye. 6 extraocular muscles control the movement of each eye: the superior, inferior, medial, and lateral recti, and the superior and inferior obliques. These muscles work in coordination to move the eye in all directions, enabling binocular vision and depth perception. Their actions are finely tuned by the brain, allowing us to track moving objects, shift focus, and maintain stable vision during head movement. Intrinsic muscles of the eye include the ciliary muscle, sphincter pupillae, and dilator pupillae. The ciliary muscle adjusts the lens for near and distant vision, while the sphincter and dilator pupillae control pupil size in response to light. These muscles are regulated by the autonomic nervous system, ensuring the eye adapts quickly to changing visual demands and lighting conditions. Vision begins when light rays enter the eye and are refracted by the cornea, aqueous humor, lens, and vitreous humor. These transparent media focus light precisely onto the retina, particularly the macula where visual acuity is highest. Any irregularity in these structures can cause refractive errors, leading to blurred vision. The eye's ability to adjust focus for objects at different distances is known as accommodation. Accommodation is the process by which the lens changes shape to focus on near objects. When the ciliary muscle contracts, the lens becomes more convex, increasing its refractive power. Convergence refers to the inward rotation of both eyes to maintain single binocular vision as an object approaches. These processes work together to ensure clear, focused images at varying distances. Retina contains two types of photoreceptor cells, rods and cones. Rods are highly sensitive to low light and are responsible for night vision, scotopic vision, while cones function in bright light and enable color vision, photopic vision. The fovea, located at the center of the macula, contains only cones and is the site of highest visual acuity. The distribution and function of these cells are essential for adapting to different lighting conditions and perceiving color and detail. When light stimulates the retina, three types of sensations are produced: light sense, form sense, and color sense. Light sense allows us to perceive brightness and adapt to changing illumination. Form sense enables us to distinguish shapes and patterns, with the greatest acuity at the fovea. Color sense is mediated by three types of cone pigments, each sensitive to red, green, or blue wavelengths. The combination of these sensations creates our rich visual experience. Visual pathway begins at the retina, where photoreceptors convert light into electrical impulses. These signals travel via the optic nerve to the optic chiasma, where fibers from the nasal retina cross to the opposite side. The optic tracts continue to the lateral geniculate bodies, then through optic radiations to the visual cortex in the occipital lobe. This complex pathway allows the brain to integrate and interpret visual information from both eyes. Eye's blood supply is primarily from the ophthalmic artery, a branch of the internal carotid artery. Key branches include the central retinal artery, short and long posterior ciliary arteries, and interior ciliary arteries. The venous drainage is via the central retinal vein, vortex veins, and interior ciliary veins. The unique vascular arrangement ensures that each layer of the eye receives adequate nutrients and oxygen, while also providing a route for waste removal. Eye receives sensory, motor, autonomic, and secretomotor innervation. The ophthalmic division of the trigeminal nerve supplies sensory fibers to most ocular structures. Motor control of the extraocular muscles is provided by the oculomotor, trochlear, and abducens nerves. Autonomic nerves regulate pupil size and accommodation, while secretomotor fibers from the facial nerve stimulate tear production. This intricate network ensures precise control of eye movement and function. Clinical examination of the eye begins with inspection of the head, face, eyebrows, eyelids, and eyeball. The interior segment is assessed for size, shape, position, and any abnormalities. Special attention is given to the conjunctiva, sclera, cornea, anterior chamber, iris, pupil, and lens. Palpation can detect tenderness, swelling, or abnormal pressure. Advanced tools like the slit lamp and gonioscope provide detailed views of the cornea, chamber angle, and lens. Posterior segment includes the retina, optic disc, and vitreous. Subjective tests assess visual acuity, field of vision, and color vision. Objective tests like retinoscopy, ophthalmoscopy, and electroretinography evaluate retinal function and detect abnormalities. Careful examination of the optic disc, blood vessels, and macula is essential for diagnosing ocular and systemic diseases. Fraction is the process of determining the eye's focusing power and identifying refractive errors like myopia, hypermetropia, or astigmatism. Retinoscopy is an objective method where a light is shown into the eye and the movement of the retinal reflection is observed. By using different lenses, the examiner can determine the corrective power needed for clear vision. This test is especially useful in children and nonverbal patients. Based on retinoscopic findings, corrective lenses are prescribed to compensate for refractive errors. The goal is to provide the sharpest vision possible without discomfort. For presbyopia and age-related loss of accommodation, additional near vision correction is added. Accurate lens prescription is essential for optimal visual performance and comfort in daily activities. Vascular tissues like the cornea and lens rely on specialized metabolic pathways for energy. They derive nutrients from the aqueous humor and paralimbal capillaries. Oxygen is absorbed directly from the air by the cornea. The transparency of these tissues depends on precise hydration and metabolic activity. Disruption in metabolism can lead to edema, opacity, or degenerative changes affecting vision. Blood-aqueous barrier is a system of semipermeable membranes that regulate the exchange of substances between the blood and intraocular fluids. It exists at the retinal capillaries, ciliary epithelium, and iris capillaries. This barrier maintains the clarity of ocular media, but also limits the penetration of therapeutic drugs, making treatment of intraocular infections challenging. Only lipid-soluble substances can cross easily. Normal intraocular pressure ranges from 10 to 20 Hg and is essential for maintaining the shape and optical properties of the eye. It is regulated by the balance between aqueous humor production and drainage. Increased pressure can damage the optic nerve, leading to glaucoma, while low pressure can compromise the eye's structure. Accurate measurement is vital for early detection and management of ocular diseases. Human eye is a masterpiece of biological engineering, with each structure perfectly adapted for its role in vision. From the embryological origins to the intricate layers and specialized functions, every component works in harmony to capture, focus, and interpret light. Understanding the anatomy and physiology of the eye not only deepens our appreciation for this vital organ, but also highlights the importance of eye care and regular examinations. Regular eye examinations are essential for maintaining good vision and detecting diseases early. A thorough eye exam includes assessment of visual acuity, refraction, inspection of external and internal structures, and evaluation of intraocular pressure. Early detection and treatment of conditions like refractive errors, cataracts, glaucoma, and retinal diseases can preserve sight and improve quality of life. Always consult an eye care professional for any vision concern. Conclusion: the eye's complex anatomy and physiology enable us to experience the world in all its beauty and detail. From the moment light enters the eye to its interpretation in the brain, countless processes work seamlessly together. Protecting and caring for our eyes ensures that we continue to enjoy the gift of sight throughout our lives. Thank you for joining this exploration of the human eye.